It definitely helps me accept what it is I'm living with, how I'm living with an incurable cancer.
Being able to discuss that with people in a similar situation is really important to people.
Well, I think this course is a really good way for patients and their carers to get access to a whole wealth of other useful information.
So the Thinking Ahead programme is a 7-week course, an hour and a half each week, where we bring patients and families together that have incurable cancer diagnosis.
The Thinking Ahead programme is essentially an education programme. What the Thinking Ahead programme gives patients is the opportunity to think through worries and concerns that they may feel following being given that information around the fact that they are going to, at some point in the future, die. The education programme will address certain issues that we know from patients previously are really important around the emotional concerns that somebody may have around being told that their life is fairly limited.
They're able to get the benefits of seeing facilitators from a professional point of view, to have discussions around their end-of-life care options, around benefits and planning ahead, and also estates planning, an opportunity to think about uncertainty and help them through the difficult times that may lie ahead for them.
Hello, Janice. Very nice to meet you. Do come in and have a seat.
There are obviously challenges in trying to signpost to a programme like this, and I think one of the things that we hear a lot is there isn't time to do this in the clinic, or it isn't my responsibility, or somebody else should do this, and I hear myself saying those things as well. But I think the thing that's really useful about a service like this is it provides an enormous amount of extra support to patients, and actually that's helpful to us as clinicians as well, because that provides a lot of additional support that then makes the more difficult conversations that we may have to have later on in the treatment easier. So actually I'd encourage people to try to make some time for this, because I think it adds a lot of value to people's care.
Before we go on, is there anything you wanted to ask me about what we've discussed so far?
You know, I have a family, and I want to talk to them about it, but I just want to prepare, if I could be helped in that way.
Yes, of course, and actually brings us on very nicely to a course that's being run online for people who are in a situation like yours with an incurable cancer.
One myth is that the patient isn't ready to consider their future. Some patients won't be ready to consider their future or won't want to have these discussions, but what we need to do is consider what's important to that patient. So that is about having those discussions earlier in a sensitive but a positive way.
If a clinician feels that a patient perhaps isn't ready to have that conversation, I don't think people can know that. I don't think any clinician can know that unless they ask the patient. It's about their lives, and they need to be able to take control of the time that they have left.
There is no right or wrong time, but putting the information forwards to someone sooner rather than later at least gives them the opportunity to look forwards, to look out, to find something to research.
It might be you think that's something helpful for you.
Yeah, and I think it might be useful for me to just, I suppose, think a little bit more with support about some of the things I'm going to have to consider going forward. It'd be useful for my family, because there might be times when I can't talk about things I need to talk about.
So if a clinician thinks that they don't want to have that conversation because they want their patient to remain positive and hopeful, I think that sending a patient away without having had the conversation about the Thinking Ahead programme, without giving them the opportunity to think about the future, really causes a patient a huge amount of anxiety. Being able to address and move those concerns and anxieties to one side will give the patient the opportunity to live a much more positive, hopeful life, knowing that they will be supported.
And what we've seen from previous programmes is that patients and families really feel supported by the other patients and families that are on the programme that are going through a similar situation to them.
People find it helpful to think about these things sooner rather than later.
Another myth that comes up with programmes like this is that they're not appropriate while patients are still receiving active treatment. And I think it's important to realise this is something which can very much run in parallel to ongoing therapy, and it's not about one or the other. This is a programme which is designed to help people to make the best of the time and the quality of life that they have.
Having gone through it and knowing what the support is I've got on the other side, it has to be told to everyone.